The Kannada actress Chetna Raj's death is really disturbing news, and I'm very sorry for the family. They lost their daughter. It's a very difficult time for anybody, and uh, as a cosmetic surgeon, we also do a lot of liposuctions, and we also see a lot of complications. And people have to understand one thing: the each surgery carries definitely a risk factor. Each body reacts to the same surgery in different way, and a lot of times uh, we evaluate them completely, but still there is a very rare conditions which we can't evaluate for each and every patient. This is not practically possible. This is not possible at all. So during liposuction, we do remove fat cells by a power assisted as well as the laser, as well as the a lot of other methods also there. And uh, usually, see, what I understand from this case scenario is patient is fit patient, 21 years only, and the patient doesn't have any comorbid factors like diabetes or hypertension. Um, uh, she underwent for a smaller area, not very major liposuction, actually only a tummy and lower back, done under epidural anesthesia. And epidural anesthesia is also safest anesthesia, and it done by a qualified team. Anesthetist is well qualified, and Dr. Shetty is very well qualified as well as well experienced surgeon, and he has done a lot of liposuctions and happy clients all over the world, and and so they know what they're doing. Okay, but on the table they found hypotension and sudden loss of the sudden cardiac arrest. So they can't do anything at that time. They need to revive the patient. That's the only thing. See, none of the doctors wants the patient to die. Doctors will be, see, more than the family, doctors will be very upset when something happens to the family. So always we consider them as their own family members, and we put our own efforts. So they have done a CPR, cardiopulmonary resuscitation initially. That's how every doctor supposed to do. So because that time we are not, like we can't shift the patient immediately. The patient is already, like in cardiac arrest. We need to treat the problem first before shifting to the higher centers. So they have to try their best first. Then only they can shift the patient to the outside hospitals. So unless you stabilize the patient, you can't shift the patient to the other hospitals. It's a one patient interest doctors are doing, and so what goes wrong here? See, a lot of things even the patients have to understand. Sometimes the patients also lies. So they see, ideally normally they have to stop eating and drinking at least 8 hours, 6 to 8 hours prior to the surgery time. Sometimes when you ask, they say that because they are afraid that we'll cancel the surgery, they say that no, I didn't, I had water only 6 hours back, but they should have consumed a lot of water. And sometimes smoking and a lot of other things they don't reveal to us. That's also one of the problem from the patient side. And doctor's perspective, see, whatever we do our own patient's own interest. See, none of the doctors wanting to spoil a patient's life, so we do our best. And but sometimes the same surgery and same medicines will react differently to the differently in each and every patient. Sometimes it's kind of a very rare incidents happen. It happens to any doctor's life. The media also projected a loss because cosmetic surgery, they feel it's unwanted surgery, but people never realize that how much it improves the self-confidence, and how much you don't even realize how much it helps the patients in their day-to-day lives. And see, if it happens to any emergency surgeries, patients will be okay. Since everybody will be okay, but this is the elective and cosmetic surgeries. People feel that that is not correct thing. We don't understand. We take all extra precautions. In fact, we have a lot of checklists, and we have a lot of advanced equipment to make the patient's recovery and surgery better. So we have to wait for the post-mortem report to know the real status. It will take another 10 days at least. Till that time, don't speculate anything, don't spread rumors, and we totally understand the parents' emotions now, and it's very understandable whatever they are doing also. But this is a reality. So unless otherwise really it disturbs you, don't think about the cosmetic surgery. See, the risk of cosmetic surgery is like, like if you walk in the road, hit by the bus, how many percentage chances? It is much lesser than that. So we are walking in the road, and same time, it's the same way. Cosmetic surgery also carries a lot of risk. When it's needed, it's really a helpful tool. Unnecessary cosmetic surgeries has to be avoided. But this case is a very genuine case. I don't feel any fault in a doctor's side in this scenario. Thank you.